Hello everyone. Today I am going to present my capstone project on the mental health of the nurses during COVID-19 pandemic in the Healthcare Organization of Canada. First of all, good mental or psychological health is crucial for all the nurses, and the poor mental health of the nurses can affect the day-to-day functioning, physical health and ability to work properly and many more things. The main rationale of my project is to identify the factor affecting mental health of the nurses and promote the mental health of the nurses by implementation of effective solutions. There are various causes of the poor mental health of the nurses. The first one is because of the patient suffering from fatal disease, there is increase in stress of the work at the workplace. The second one is the fear of communicable condition and the infection disturb the nurses psychologically and emotionally. And third one is emotional health of the nurses affects because of the fear of loved one death. There are various solutions that can be implemented to promote the mental health of the nurses and make the nurses psychologically strong. Provide the proper physical and psychological support to all the healthcare providers. Second is there should be proper division of the working hours, patients, duties, and responsibility for reducing the stress of the heavy workload. Third is provide proper training and development should be arranged for providing knowledge regarding the personal protective equipment and triage so that they can provide proper care as well as provide patient centered care according to the need of the patient. And last one is follow the principle of ISO standards, for example relationship management, continual improvement, involvement of the peoples and proper leadership, etc. Now, I would like to discuss the expected outcome of the research. First of all, the study outcome. Implementation of the various solutions reduce the mental disorder of the nurses. Psychologically, sport helps to reduce the fear, stress, and anxiety of the nurses, and they can provide the high quality care to the patient. Proper coordination and cooperation also improve the emotional health of the nurses. Proper division of the working hours reduce the risk of the staff burnout and make the nurses physically and mentally strong. Effects of the outcome on the leadership, client, and the families. These solution and the outcome positively impact the staff, leadership, family, and the client because it encourages the open communication for generating solutions. It improves the staff and the client satisfaction and promote their mental health as well. The second one is ACT. I would like to implement of all the policies and procedure for adequate social support from the families, co-workers and the loved one, and follow the principle of ISO standards for adequate managing the stressful situation and quality improvement. There should be proper working environment and organizational culture that is suitable for all the nurses. Proper training education of the nurses is also mandatory. There are various barriers that will decrease the chance of implementation of solution of these problems. Lack of clear role of the healthcare workers to ensure the best result of the proposed changes. Lack of communication and coordination between the workers, leaders, and the managers also act as a major barrier to implement all the changes. Now, I would like to explain the sustainability plan. There are various roles that the leader should play to implement the changes and promote the sustainability plan. Leaders should provide proper education to the followers regarding the policies and the procedures to promote the social support. Leaders should also encourage the participation of all the workers and involvement of the patients and families and coordination while managing any stressful situation. Plan to ensure sustainability. Leaders should empowering and uplifting the nurses for participation in all the decisions. Motivate all the workers to follow the various principles, rules, regulation and implement all the changes for promoting the mental health of the nurses. There should be open communication for discussing all the problems. It is necessary to ensure the psychological development among the staff in the organization to understand various issues and the solution. This is all about my capstone project. Thank you so much for your attention.